I just wanted to cover a couple of brief things in transition from yesterday and from some of Ray's talks this morning. So I'm going to cover a lot of ground, and please fasten your seatbelts and activate all 300 million of your algorithms to hopefully match your seatbelt experience. I met Larry Smarr at FutureMed last year, and what we talked about yesterday in terms of the panorome, the phenome, the socialome, and the exposome, Larry and I are within moments of having a long-term contract in place for a strategic collaboration between his institution at UCSD and Kaiser Permanente. And there are 4 other collaborations that have emerged for me personally out of my previous experiences here at FutureMed. So to Daniel's point, don't waste a second here. There's lots of opportunities for collaboration. Daniel asked that we sprinkle in a few predictions, so I've done that. And I've also taken the liberty of injecting some of the implications of exponentiality for social equity. I'm going to try and cover that. Ray mentioned that recently a gene was modified in order to address its impact on obesity. And just as a teaser for what Larry Smarr is going to talk about later today, I sent Larry a paper about a month ago that was just published about identical twins that were discordant for obesity. One twin was identical twin was obese, the other was not. They isolated the differences in their microbiomes, took that delta, injected it into genetically obese mice, and lo and behold, they lost weight. So the microbiome is going to really revolutionize a lot of medical science. So what I'd like to do is cover a couple of things. The title is The Healthcare Plecosystem, The Mothers of Invention, and the Collaboration Imperative, including Social Equity. So I'm going to try and race through that fairly quickly here. Quick responses. How many engineers in the audience? Show of hands. Okay, designers. Artists, poets, musicians. Okay. How many filed a patent? About 30%. How many use Uber? And how many of you know your personal Uber score? Anybody? Guess what? You rate Uber, the cabs, and they have a rating. They rate us. Top score for them is 5. Top score for us is 5. If you're in a 3.5 because you're rude to a cab, they're not going to pick you up. So there's a notion of symmetric democratization that's occurring as well. Anybody heard of innovation blowback? How a lot of work is being done in the third world because of the absence of the regulatory constraints that we have, and then bringing it back to the U.S. Behavioral economics, blue zones. How many people have heard of blue zones? Okay. How many have heard of open notes? It's a great project that I'll come back to in a little bit. Does anybody know the mortality rate of the H7N9 influenza outbreak in China right now that has crossed the barrier, so it's human-to-human transmission? Anybody know? It's 30%. There's a lot of reason for us to be concerned about how rapidly we can use this exponential technology to detect, create vaccines, and print them worldwide, as Craig Mentor has eloquently described. How many of you know how many chimeras are sitting in this room? People with cells from more than one embryo. Okay, quick show of hands, how many women have children? Okay, you are all chimeras. It's been recently discovered that stem cells from your children almost invariably make it into your organs during gestation. Finally, does anybody know where the Centers for Altruism and Empathy have emerged just in the last year or two? There's one at Stanford and one here at UCSD. And I think a lot of what we need to pay attention to around what we do with the exponentiality of technology has to do with empathy and altruism. How many have read Goodnight Moon to your children? Or to any children? Okay, cool. Then you recognize the format of my slides. Okay. This is just an homage to Sidney Garfield, who you just saw in the film. I like to refer to him as the Steve Jobs of healthcare because he envisioned not only integrated delivery system, which I enjoy the benefits of working within, but totally integrated systems in support of it. And this is from Scientific American in 1970. This is a slide I used to help acquire funding for the multi-billion-dollar health record project. It's the classic learning cycle: measure what you do, model it, simulate it, change your decision support, model the difference. Lower left, couple of examples. So the argument I made for why we should spend billions of dollars had to do with reducing cycle time of discovery and implementation. So we've gone from an average of 17 years from the discovery and widespread implementation of new knowledge to literally days and weeks. So a couple of examples. Vioxx was discovered to have a lot of toxicity. We took it off the market the same day we took it off our internal formulary the day we discovered it. There was a paper published a couple years ago that half of all patients who've had a splenectomy are at risk of very sudden death from a common bacterial pneumococcal, and that they had not had their pneumococcal vaccine. So in 3 hours, I ran through 20 million records and identified all those patients who had had a splenectomy. You had to use natural language processing because those are usually done after trauma, car accident, and are done in St. Elsewhere, and was able to now vaccinate all those patients. Adverse drug reactions, same NLP team has gone through our records looking for known ADRs and discovered many new unreported ADRs just as a collateral benefit of doing that study. And then finally, ILI is influenza-like illness. It turns out that on Facebook, you can detect, shut that off, you can detect influenza-like illness about 2 weeks ahead of the CDC. So all of these things are converging to accelerate the learning cycle time. So a couple of things about how we implemented the health record. We came in a year ahead of schedule and $260 million under budget. That's pretty difficult to do in a large-scale project. We used a very flexible fishnet model of organization, sort of an exponential organization, as was referred to yesterday, with intense collaboration. And throughout the process, we had tens of thousands of decisions to make about how we configure the system. And in every case, we resolved it by saying, let's put the person first. Not the patient, not the consumer, but the person. Dennis Robbins is here in the audience, and he's popularized the notion that we don't need to look to a convergence of patient and consumer. We need to look at the whole person, and that's what we did. And very successfully trained 70,000 users in a matter of 2 years on about 30 apps. So what's sort of the big bottom line? These are published mortality rates from Medicare services. And the top line is the average hospital mortality across the country. And the lower line is Kaiser Permanente in Southern California. There's two important things. We're currently 26%, you're 26% less likely to die in a Kaiser hospital than the average hospital in the US. And look, the gap is widening. The reason the gap is widening is because of our exploitation of exponential technologies. So Samuel Arbison wrote a book last year called The Half-Life of Facts, Why Everything We Know Has an Expiration Date. John Ioannidis, a professor at Stanford, has proven that 41% of all medical literature is subsequently refuted. And context king is going to replace content as king in the world of big data analytics. So what about health data liquidity? There's a lot going on in Washington today to try and increase the liquidity of data. And so there's a whole lot of effort in this. Health information exchange, personal health records, Blue Button, Open Notes. Open Notes is a out-of-the-box feature of several health records now, where when I sign a note and it goes to the chart, it automatically goes to the patient at exactly the same moment, along with their lab results and so forth. And then research collaborations, there's dozens, new research collaboration in healthcare emerging every week. My favorite quote is from H.L. Mencken, that for every large complex problem, there's almost always at least one very simple solution, and it's usually wrong. And so we're dealing with a very, very complex environment. Even with the exponentiality of technology to help us solve the complexity, we're recognizing increasingly the complexity. The Nobel Prize in Chemistry this year was awarded for 3 collaborators from 3 different countries, ended up in the US, from 3 universities, who used 2 entirely different technologies, one using Newtonian physics and the other using quantum mechanics, to model how proteins had active sites and what the function was. So this is a really good exemplar about how cross-disciplinary collaboration is critical in the world of exponentiality. Does anybody recognize this famous painting? Anybody know the name of this one? Please. Pardon me? It's Boy with a Knapsack, Kazimir Malevich in 1915. This was a milestone in abstraction, and the reason that, Ray talked about poetry and music and algorithms, and the reason it's important is because this is a social graph of the people almost exactly a century ago who created abstractionism and included Pablo Picasso, but also included Claude Debussy and a whole raft. These are all poets, musicians, and artists who were connected and together created the art of abstraction. And there's a fabulous book called Inventing Abstraction that these came from that I highly recommend. I'm going to describe what happens in meiosis. So there's 3 stages. In the first stage, you take the chromatid from the mother and the chromatid from the father, and you line them up, connect them by a kinetochore, and you just have this random swapping of genes in mass across all the chromosomes. And then moments later, you randomly separate the chromatids, so you get some from your mother and some from your father, and then minutes to days later, there's fertilization of an egg and a sperm. And yesterday, somebody mentioned how we're really beginning to exploit biology and really understand how to use exponentiality and high technology. There is nothing more ingenious around innovation than the process of meiosis, because in a matter of minutes, you have 3 complete, massive, deliberate mashups of ideas. If you consider genes ideas, which they are, meiosis is the ultimate example. So what I've begun to think about in terms of the complexity of what we're dealing with is that we have a plethora of platforms in our ecosystem, and so I've abbreviated all that into the term the healthcare Plecosystem. And there's more than 10, but just to keep it all on one slide, the internet and the cloud provide connectivity, smartphones with video dial tone and modality steering, knowing which kind of conversation, whether it's a secure messaging or same-time messaging or an app on the phone or video conferencing, knowing which modality is appropriate for which type of intervention is critical. And I like to think of the mobile phone as stationary. This notion that it's mobile is really upside down, because really they're attached to our bodies. So wherever we go, we have our phone. And so it really brings the world of the cloud to us wherever we are. And in that sense, from a person-centric view, it's stationary. Digital social technologies creating the socialome. We've got some projects going in that space. Pervasive environmental sensing. You're in the county in the US that has the densest set of mobile and fixed sensors anywhere in the world. Kevin Patrick at UCSD, part of Larry's team, is doing that work. The quantified self and the tricorder for non-invasive biometric testing and how it enhances our capacity to understand what's important. So a lot of what we need to do, and one of the companies that was spawned out of a prior future med is here, jointly.io, looking at how to make sense out of these massive streams of data and escalating outliers from machine to human. Exponential decline in the cost of sequencing, we've covered that a million times already. Digital phenomic data, so that's what the health record at Kaiser Permanente does. We have massive amounts of information on many millions of patients. Big data analytics and visualization. My prediction is that by 2020, there'll be 10 times more legitimate medical knowledge generated in silico and in vitro, as opposed to the traditional randomized controlled prospective trials in vivo. And in vitro, what I mean is organ systems in vitro that can be tested. The 9th one is behavioral motivational sciences and persuasive technologies, huge literature there. And avatars increasingly are going to broker the digital relationships between individual people and other information sources. So there's an increasing necessity for collaborations among multiple dimensions, centralized versus decentralized, identified versus de-identified data. I just wrote a chapter in a book about how de-identification at the machine level is a quaint mythical notion that no longer exists. And then professional versus consumer source, and people spoke about what Linda Avey's doing with Ubiome for crowdsourcing citizen science. There's new multi-institutional collaborations every week, and it's my belief, and the reason I put Mothers of Invention in the title is how well our mothers taught us to share our toys is going to determine how successful we are in this new Plecosystem in collaborating with others across disciplines and across institutions. So the quantified self movement, Larry's going to talk about this in more detail, so I'm just going to mention a couple of things at the bottom. Sneak peeks was mentioned yesterday, where you can do a mashup of prospective mother and father genome. What wasn't said yesterday is that this was not some random person who started this company. It's a professor at Harvard who went to sperm donor banks to identify a good match and found that they could tell her next to nothing. And so she actually had a child with a severe metabolic disorder, and that led her to do her startup. Easy DNA, Jerry Springer no longer has a monopoly on Who's Your Daddy. And when you think about it, with 20% of some communities where the kids have false identified fathers, there's going to be some major disruption as we see this exponential growth in people who know who their biologic father is. The data that's contained within all these silos has far less value than when we connect it. The only way to really connect it is through the individual. We need to be able to preserve identity in order to extract the value of all these different data sets, which threatens our very notion of privacy. And so we have a big educational campaign ahead of us of the public to change the zeitgeist. Moffitt Cancer Center in Florida has a 1-hour video they show to every single cancer patient referred there. 96% of the people who show up there agree and sign that they will give everything about them to their current care team and to the future of science. So we need to really push that. Privacy implications, we need to have much better transparency to who has our data and what they're doing with it. And I'm on the board of Open mHealth with the Catalyst Initiative, which is all about taking mobile health apps and creating a framework for sense-making out of those data. So a prediction I made a year ago is that by the end of this year, the zeitgeist would embrace the inadequacy of security as the predominant mechanism to prevent privacy. Well, Edward Snowden brought that prediction to truth already. And I think that this is we're still having the political reaction of, oh, we need more security, but the game's over with security as the sole mechanism. So one of the things I like to talk about is transparency into what I call the black box economy. So examples are the credit default swaps and the global meltdown, how they hid risk within elaborate mechanisms, the President Gore election dispute with hanging chads, the drive-by-wire terrorism, the NSA and PRISM revelations, and free avatars that are already widely available but will be sponsored by every special interest group, political, religious, nation states, and multinationals, with ultimately being the trillion-dollar sales and marketing channel. So the question to me becomes, who owns your avatar and why do you care? Because we're going to feed these beasts because they make it so much easier for us to interact with the digital world, but what do they want from us and how do they insinuate their business model into our interaction? So open source clandestine cops, not maybe anonymous, policy, how are we going to get there? I don't know. But we need to, as entrepreneurs, think about how we're going to increase the transparency. And then there's the dilemma of, if you give that kind of transparency, you also make it transparency into some of the core IP of the people that hold your data. So a lot of opportunity there. So I want to come back to something Ray said about this growing gap between the brain's capacity to absorb 100,000 pages and the cloud's capacity that is infinite. And so visualization tools, I believe, are going to be the key differentiator for everything related to big data analytics. 3 million years of evolution. Talk to any memory expert who memorizes everybody's name. They all convert information into images, and that's how they have such good recall. So I just made this slide up. The human brain has evolved for about 3 million years with visual analytics and abstraction. We've only had 8,000 years of symbolic abstraction with letters and numerals, 500 years from Gutenberg, 100 years of literacy, 10 years of YouTube. We know now, just recently, that the image of a snake is hardwired genetically into our brain. We're not taught, if it looks like a snake, run. It's actually hardwired in our brains. So our brains are all about visualization and in terms of processing large data sets. So visualization tools are going to be key differentiators across the board. We need to support 3 different conversations in healthcare with these visualization tools. One is between the patient or person and their professional care team. One is between the patient and their personal care team. And the third conversation is between that patient and their whole person that houses that patient persona. And this is where Dennis Robbins' work on person-centricity becomes important. So what we need to do is we need to be able to represent all of this flood of complex data in terms of options that are represented in terms of human values, like I want the maximal possible treatment, I don't care about the side effects, or my daughter's getting married in 3 months, give me the safest drug until she's married. When I get through the wedding, then I want maximal possible benefit and lowest risk. And how do you drill down from those value sets into the actual data? So I think visualization is going to replace the current electronic health record model and support all 3 of those conversations. So just a teaser, Larry Smarr has done amazing work using visualization to translate terabytes of data into something human consumable that you can see, untrained eye, looking at 37 patients' microbiomes and picking out the one abnormal microbiome among 37 just because of the brilliance of his team and their work on visualization. So where are we in terms of managing healthcare costs? Disorders of lifestyle, driving obesity, diabetes, cancer, heart disease, stroke, yada, yada, yada. I'm just going to focus on that a little bit because the decisions that we make that drive these epidemics of disorders of lifestyle are not really responsive to information therapy. Otherwise, McDonald's would have had its best ever revenue year last year. So how do we create a behavioral symphony of wellness to help people shift their behaviors towards health? So we can try one more video, and if it doesn't work, we'll just skip it.
I've worked with people a long time across the lifespan, even in their 90s, And they can change if they're inspired to change.
To change your life, you have to change your mind. And the good news is, you can. Your brain cells have the power to build new pathways that will reinforce what you learn and do, including better health habits. This power is called neuroplasticity.
Neuroplasticity is the way the brain changes its structure in response to experience. Experience always means energy and information is flowing through the nervous system. So whenever you think experience, you have to think of neural firing. What we know is that when neurons repeatedly fire together, they wire together.
Brain cells, or neurons, pass impulses through branching arms called dendrites to other neurons. They can grow and form new, more efficient pathways. When you make a decision repeatedly, your brain forms a shortcut, helping the habit become nearly automatic.
Let's stop it there if we could. Go ahead and kill it. Thank you. So Peter Diamandis has written about this growing gap between new technology and the human brain, the capacity to absorb it, calls it the disruptive stress gap. This is a cartoon from the LA Times 2 years ago showing what it feels like for a primary care doctor. This is real. This is how our primary care docs feel. They are overwhelmed with this flood of information and tasks visiting them. So the network or the cloud is your brain doctor, elegant visualization needed. We need to restore the space for caring. From this, what hand is missing? This doc has 10 hands. Not one hand is touching the patient. We need to be able to restore the space for caring in healthcare. Predictions, again, elegant visualization is going to be the key differentiator, and advanced analytics and decision support, both AI and intelligent assistance, will be externally modularized in health records. And we need to personalize all aspects of the delivery of health, including the communication modalities, the methods of behavioral tools that work for different individuals. There's one of the coolest levers I've ever heard of is that there's an app out that if you don't meet your commitments, it actually makes a donation of your money to the political party you're opposed to. Very clever. Okay. Avatars and robotics are going to deliver the anthropomorphism of messaging. Again, we are people. We respond to human cues. I like to refer to the behavioral symphony of wellness as the social determinants of health, the early childhood interventions, access to parks and healthy foods in the inner city. It isn't going to come from mobile apps alone. We need to look at a much greater synthesis of changing behaviors. I'm going to skip this, just a reference list. Last thing I want to mention is 3 tiers of pervasive sensing. So the athlete warrior with real-time tuning of high performance, chronic illness post-discharge from hospital, really identifying events early. The rest of us, we don't need digital nannies. So if you think of the tricorder and the quantified self as a digital nanny, the attrition rate's very high. How many people here have ever worn a Fitbit or a pedometer? Hands, please. How many people have one on today? Okay, so I'd say less than 50%, but my belief is that we need to train ourselves not to look at the number of steps we do each day, but to train ourselves to look at an elevator and say, where is the stairway? We need to internalize things through mindfulness and use it to initiate and motivate and then calibrate our behavior over extended periods of time. So this is Homo metricus, the evolution of the highly instrumented quantified self. This is what some of us resemble as Homo geekus. And thanks to McDonald's, we have Homo fast foodorus. But where we need to go with mindfulness, and this is where East meets West, and we really need to look at the wisdom of the past and what people have found in blue zones that actually extend health and longevity, is mindfulness. So this is the evolution that we need to be using these technologies to converge upon as mindfulness rather than digital nannies. So where's the friction in healthcare? Andy Groves and Vino Kosla have both said that 80% of all doctors are going to go away. I agree with them. 80% of all current tasks need to be moved upstream, and the friction needs to be removed, but other things will come back in. George Packer has written in the New Yorker and the New York Times and a book now on the difference between democratization and true social equity. So we need to be mindful that democratization alone is necessary but not sufficient to cross the digital guide. I'm going to skip a bunch of slides on childhood determinants of health that Jana has given me. in the interest of time, but there is evidence that prolonged stress in childhood keeps sustained high levels of cortisol dramatically alters neural function for the rest of your life. And I believe that, and there are a lot of prison wardens who believe that the prison population is a direct reflection of the maldistribution of early childhood support. So there was a study called ACE, for Adverse Childhood Experiences, here in San Diego, CDC and Kaiser Permanente, and it revealed lots of compelling evidence that so much of our future is determined in early childhood through toxic stress. I'm going to go back to that one because 7 of the 13 determinants are related to health and safety, and we really need to address these issues early in childhood. So the last thing is collaterals of exponentiality. There was a TEDx in Turkey last year called Reset TEDx. Richard Florida wrote the book Reset, looking at the disappearance of middle class. So 52% of current jobs have been identified as at risk of being disintermediated through exponential technologies. We really need to think about how we, as innovators, not just reduce friction, but how we create dignified jobs for the 52% that will be displaced. Last slide of all. Hubert Humphrey, hanging on the wall at Health and Human Services, has a quote that I love. It says, "It's been said that the moral test of government is how the government treats those who are in the dawn of life, the children, those who are in the twilight of life, the elderly, and those who are in the shadow of life, the sick, the needy, and the handicapped." So as we reduce friction from the system and as we democratize technology, let's not forget that democratization is necessary but not sufficient if we're going to address social equity. Thank you very much.